At least 30 minutes prior to a planned intervention, such as mobilizing or physical therapy, it is important to pre-medicate with any antiemetics, oral pain medications, or muscle relaxants that you want to give. This also allows the patient time to mentally prepare for getting out of bed. A 10 to 20 minute warning is helpful to those patients with a PCA so that they have time to dose themselves once or twice prior to planned interventions. When you enter the room, you will have to move any item that is attached to the patient to the side of the bed you intend to turn the patient to. These items include IV poles, Foley catheters, chest tubes, drains, PCA, and/or epidural pumps. If you have multiple IV poles, it is helpful to consolidate items to one pole. It is important to start the log roll when the bed is completely flat. Make sure that the bed is adjusted to a comfortable height for you and your assistant. This is also the time to ensure the proper placement of the draw sheet. The top of the draw sheet should be at the level of the patient's shoulders, and the bottom should be below the level of the patient's hips. The patient should not help with the rolling, but rather place their arms across their chest as the two-person log roll takes place. The patient should be instructed to bend their knees and tuck their chin to their chest. Once the patient is on his or her side, the assistant will move to the side of the bed that the patient is facing. In one motion, one person will help mobilize the trunk, head, and neck, and the assistant will help with the bottom and legs. Once stable in a sitting position, have the patient keep their eyes open and looking straight ahead. This is the point at which many patients feel nauseous or dizzy. Allow them to sit and re-equilibrate for a few minutes. When the patient is ready to stand, he or she will require assistance. Each person will stand to the side of the patient and lend one hand to the patient for balance, and will place one hand under the bottom to help assist the patient to standing. Again, allow the patient time to re-equilibrate, and once ready, the nurse may only need to provide assistance with the IV pole and clearing the path of obstacles. Early mobilization of postoperative spine patients has multiple medical benefits. With the proper technique and preparation, you, the nurse, can get your postoperative patients up.